Assalamu alaikum, welcome to Medical Corner. Today, our topic of discussion is the diagnostic test for the elbow joint. So, first of all, we should have to revise our background knowledge of anatomy about the elbow joint. It is the synovial joint. Its freedom of movement is less, but its stability is very good. There are the three bones, that is the humerus, radius, and ulna, that articulate and form an elbow joint. To learn the articulations of the elbow joint, you should have to remember mnemonic, that is the crazy tulip. So the capitulum articulates with the radius and the trochlea articulates with the ulna and forms an elbow joint. And the next one are the ligaments of the elbow joint. The first one is the ulnar collateral ligament. Second one is the radial collateral ligament, annular ligament, and the quadrate ligament. The first one is the ulnar collateral ligament that originate from the humerus and insert at the ulna. And the second one is the radial collateral ligament that originate from the humerus and insert at the radius. And the third one is the annular ligament that surrounds the radial head and also prevent the dislocation of the radial head. Then let's discuss about the movements at the elbow joints. These are basically flexion and extension. Flexion is performed by three muscles. Its mnemonics is 3B's bend the elbow. The first one is the bicep brachii, second one is the brachialis, and the third one is the brachioradialis. And the extension is performed by tricep brachii. And the two other movements, that is the supination and the pronation of the forearm, is occur at the radioulnar joint. And the next one is the common origin of the muscles. It is very important clinically that the common flexor tendon is originating from the medial epicondyle of the humerus, that you people can appreciate it in this picture. The common flexor, actually, the flexor muscles of the forearm perform the flexion at the wrist joint. And the second one is the common extensor tendon is originating from the lateral epicondyle of the humerus, and the extensors of the forearm perform the extension at the wrist joint. And it is very important clinically that we will discuss it later. These are some clinical notes related to the elbow joint. If there is sudden direct trauma at the elbow, it may cause the fracture at the elbow joint. Radial head fracture is very common in the adults. The next one is the epicondylitis. It might be the medial epicondylitis or the lateral epicondylitis, and these are very common in our population. This is basically the overuse syndrome. Next one is the arthritis. It developed in the later ages. Next one is the lateral collateral ligament tear. This tear usually occur when a person fall on the outstretched hand. And next one is the medial collateral ligament. And the last one is the nerve compression, especially the ulnar nerve compression occurs at the elbow joint. So let's discuss about the most common pathologies of the elbow joint. The first one is the medial epicondylitis, which is commonly known as the golfer elbows, or the medial epicondylalgia, or the medial epicondylosis. With this problem, patient present with the pain at the medial epicondylitis of the humerus, from where the common flexor tendon of the forearm is originating. It is basically associated with the repetitive movement into the wrist flexion, for example, swinging a golf club or pitching a ball or working related grasping or lifting the heavy load. The result is micro damage and the partial tears, usually near the musculotendinous junction when the strain exceeds the strength of the tissue and when the demand exceeds the repair process. With the repetitive trauma, fibroblastic activity and the collagen weakening occurs. So, recurring problems are seen because the resulting immobile or the immature scar is redamaged, and when returning to the activities before there is the sufficient healing or the mobility in the surrounding tissue. With this condition, patient will be unable to participate in provoking activities such as racket sports, throwing, or golf. Difficulty with repetitive forearm wrist tasks such as sorting or assembling small parts, typing on the keyboard, or using the computer mouse, or using a hammer, or turning a screwdrivers, or playing a percussion instruments. The management of this overuse syndrome rests the muscle by immobilizing the wrist at the night in the orthosis, such as cock-up orthosis. Reduce the pain by using the counterforce braces, that is the proximal forearm orthosis. Which why we use it? Because it decreases the pain and increase the pain-free grip strength and function by reducing the force transmission to the common tendon. And then we'll instruct the patient that keep moving that part, but to avoid the aggravating activities such as the strong or the repetitive gripping functions, and do the cryotherapy. What is cryotherapy? Basically use the ice to help to manage pain. And then the most important is the cross fiber massage. And the second one is the lateral epicondylitis, also known as the tennis elbow, or the lateral epicondylalgia, or the lateral epicondylosis, or the lateral elbow tendinopathy. With this problem, patient present pain at the lateral side of the elbow, on the lateral epicondyle of the humerus, from where the common extensor tendon of the forearm muscles are originating. This is basically associated with the repetitive wrist extension, for example, backhand stroke in the tennis, computer work, or pulling the weeds in the garden, etc. The primary muscle which is involved in the lateral epicondylitis is the extensor carpi radialis brevis. Okay, now we'll discuss how to diagnose the elbow pathologies. So, to diagnose these pathologies, we'll do some diagnostic tests at the elbow joint. The first one is the Cousins test and the reverse Cousins test, mood stress test, Varus stress test, Velgus stress test, Mills test, and the reverse Mills test. We'll do all the tests for elbow joint. So let's discuss which test is used to detect which type of pathology in the elbow joint. The first one is the tennis elbow, also known as the lateral epicondylitis. To detect this problem, we'll do Cousins test, Mills test, and the Maudsley's test. Maudsley's test is specifically done to detect the problem in the extensor carpi radialis brevis muscle, which is the first extensor muscle which affect in this problem. To diagnose the medial epicondylitis or the golfer's elbow, we'll do reverse Cousins test and the reverse Mills test. And to detect the ligamentous injuries, we'll do varus stress test to detect the lateral collateral ligament tear and the valgus stress test to detect the medial collateral ligament tear. So inshallah in the next video I'll teach you how to perform all these tests of the elbow joint.